You're welcome to Health Check today on GH Today. As you can see, I'm not dressed in my usual wear. That's because today we are talking about glaucoma, and we are also going to be seeing a little surgery as well. I hope you're ready to come along with us. Doctor, you are welcome.
Thank you very much.
So today we are speaking about glaucoma. Kindly give us a short intro about that.
Glaucoma is a term, a medical term that is used for a wide variety of diseases, but it all boils down to damage to the optic nerve. What is an optic nerve? The optic nerve is the one that connects the eyeball to the brain. Over the years, it's one of the oldest eye diseases. It was there before Jesus Christ, that is BC, 2000 BC, and has always been recorded. And what is so interesting about glaucoma is that it still remains irreversible blindness. In other words, it causes irreversible blindness if nothing done early.
Okay. So
that is what makes it different from what I spoke about the other day, cataract. Cataract, you can reverse the blindness, but when it comes to glaucoma, you can't reverse it. Now, what even makes glaucoma more difficult is that people don't tend to know early that they are losing vision. So the time they realize that, oh, the vision is going, about 70% of their vision is already gone. And that is already irreversible. And that's how glaucoma has become a very important topic. Another thing is that up to today, the variety of treatment is only limited to one aspect, which is pressure. So in a nutshell, that is glaucoma.
what is the magnitude of glaucoma? How many people in Ghana have the eye disease?
Well, the last study done is that every fifth person, adult, is likely to have glaucoma.
Wow.
It's quite high.
Yes.
If you remove some of the diseases, it's actually the second cause of blindness worldwide. And why it is so important to deal with these particular diseases, most of them come very late, or both the doctor and the patients have problem with identifying exactly what it is. So you will run through a series of tests before you will come to a conclusion that this person has glaucoma. Then after that, it's how the glaucoma is cared. Yeah. So that is the thing. So it's quite big. It's a big thing. And I've been in Ghana for some time now. I would say every third person who comes to my clinic has an element of glaucoma.
Okay.
Yeah.
Okay, fine. So, what's the reason why many still go blind?
There are many reasons. Number one, the early detection is still a big issue.
Okay.
You can't go out to the community and say we are screening for glaucoma. Why? Because to make a diagnosis, a concrete diagnosis of glaucoma, then the patient has got a full-blown glaucoma. So I can't just look at you at the early stage without doing further investigation. So the primary care, the primary eye care, which takes care of early detection, is still not efficient, because we can't go out to the community and say, hey, all the people who are adults, come, let's see whether you have glaucoma, because the early stages, you will require more sophisticated equipment to detect that.
Okay.
So it is very difficult to actually do that. So those that you find are already full blown and most of them has lost their vision. That's one reason early detection is a problem. Second is the treatment. Many patients expect to regain their vision, which is not possible.
Okay.
So they go from this center to this center to this center to other form of treatment when they don't see their vision coming back. And that makes them give up at one point. what they are telling me is something I can't see. Every time I go, the doctor just give me eye drop. Every time I go, the doctor give me eye drop. And then one day they stop and it gets worse. So that is one of it. The other part is the compliance. If you detect somebody who has the glaucoma and you want to give eye drop, that eye drop is supposed to keep the pressure down. Now let me just come in here. One of the main factors of glaucoma, which we have detected many years ago or noticed, it's the pressure, the intraocular pressure, not BP, but a pressure in the eye, which is a pressure between the fluid that is produced in the eye and how it leaves the eye. There must be some balance. We've known for all these years that there are some people whose nerves are so sensitive to this pressure. So up to today, as I'm talking, the only treatment we know is to lower the pressure. But we know very well that there are many other things that can cause glaucoma nerve damage.
Okay.
So now telling somebody who has a pressure and said every day I detect glaucoma around 40 years and you have to put your eye drop up to the rest of your life, it's not that easy. Some miss their eye drops, some give up along the way. So compliance is a big issue. That is very, very important. Then we still note that there are some people, despite the fact that they use the eye drop or they have surgery, they still lose their vision. Okay? That comes to me explaining the various ways of treating glaucoma. One way I've mentioned is an eye drop. The other way is laser. And the third is surgery. All of this is to address one thing: pressure. Whether it is eye drop, whether it's laser, whether it's surgery, it's all pressure. But we know very well that there are some other factors. So we could lower pressure sometimes up to the lowest level and people still experience vision loss. Why? Because it is not the only cause of the nerve damage. So this is where the challenge is. So number one, the treatment options. Some people will not manage to take those eye drops for long. Number two, the surgeries. Sometimes they work for some period and you must go back to the eye drops. Those eye drops, for the rest of your life being on them, they cost a lot of money. So those are some of the things that are very difficult to actually adhere to, which makes it very difficult for some people to actually, and so people still go blind. Yeah.
So the treatment options that you mentioned, can you give us a bit more about those, please?
If you take eye drop or surgery or laser, it's only pressure. Okay? So, one, the eye drops, we've over the years developed many types of eye drops. Yeah, some are on 5 eye drops, which makes it very difficult. Okay, and some, fortunately, some are combined 1 or 2 eye drops in some of them, so that can work. But it's difficult to for many, and it's costly as well. So the eye drop is one option. The eye drops do have side effects, so some people are not able to use it continuously. Then the laser is another way where we could laser so that the fluid can come out easily. That also is not easily available, and for us blacks, we've noticed that because of the scarring, those are not so effective. Then the last one is a surgery. The surgery is what we do, trabeculectomy, that is trying to create a fistula between the eye and another tissue, which is conjunctiva, so it creates something like a reservoir. So the fluid.
Can you break those words down for us? The fistula and
the fistula is just an opening into the eye that divert the fluid into another chamber. Okay. So reducing the pressure. Okay. Yeah. So that is what we do by surgery. But sometimes these two fail because of the healing, because you don't want it to heal. Okay. and that can also make you go back to the eye drop.
Okay.
Yeah.
So we saw that you were injecting the eye prior to the surgery. Can you take us through step by step of the surgery, please?
So what happens is normally we have to make the place numb so that you don't feel a pain. So what we do is that we give a small injection here that will make the whole area numb, and the patient will not feel anything. And we go through all the process. Within 1 to 2 hours, it comes back to normal, and that's all. So that is just a procedure that we do, and we make sure we clean the area very well before we do the surgery.
Then what happens after that?
Oh, we clean, we take you to theater, and then the operation starts. So generally the blocking, we call it blocking, is just anesthetizing the area that you are going to work. So there will be no pain, and the eye will not be moving as well, so that you can comfortably do the surgery.
Okay.
Yeah.
So once the patient is inside, you've cleaned, you've blocked everywhere, then what happens?
No, we go in and make an incision. That incision is to make a small tiny cut where the fluid can be flowing out, and then we make sure that that fluid which is from the eye, which is causing the pressure, is directed outside. But it doesn't come outside, it's directed into another tissue, like additional reservoir. Yeah, like another, so that the pressure is controlled. Yeah.
So then once you've made the cut, the pressure is controlled, then it's just a question of cleaning up again, and then the patient comes to recovery.
Yeah, so we measure the pressure along the coming days, and some will stay for good without need for eye drop. Some may add additional eye drop when it doesn't, especially the young one, like this gentleman is young. It may heal, so but I must be a bit generous to make sure that the hole is a bit big. Yeah. Good.
Okay. So just give us a conclusion and just let us know the after effects and everything of glaucoma.
So number one, my conclusion is this: anybody above 40 should check the eye. That's number one, because you don't know. Okay, that's the first thing. Check whether you have glaucoma or not. Then number two, once you have glaucoma, there are always 3 options. 1, you use eye drop. 2, you do laser. 3, you do surgery. If you know that you don't have money or you have problem putting the eye drop, just go for surgery. Sometimes when the pressure is too high, we do surgery. We have what we go expression that we do in Agawal here, is connecting a tube, which makes the success rate better.
Okay.
So we've got a very good result out of that. Yeah.
Dr. Seniaja, thank you so much for being on Health Check today. We're so grateful that you spoke to us about glaucoma.
Thank you.
That has been us talking about glaucoma on Health Check on GH Today. My name is Nanama Anabempong, and I'll see you again next week.